My name is Christina Robinson. I'm the Executive Director of Work-Based Learning and Industry Partnerships, and we want to welcome you this morning to our Building Bridges Healthcare Summit. And I'd like to invite Dr. Madeline Grillo up to the stage to give you a welcome. She is our Southwest President as well as Vice Chancellor for Workforce Instruction for Houston Community College.
Wow, what a beautiful room in a beautiful day right here at Houston Community College, Stafford. On behalf of our staff, our faculty, and our Board of Trustees, and our Chancellor, I just want to give you a very, very warm welcome, and thank you for taking the time to be here today for this important discussion. And, you know, I was telling someone I met a moment ago, Fort Bend County, so many great things happen in this county because since I arrived here 7 years ago, one thing I noticed about Fort Bend County was the spirit of collaboration and the fact that everybody has such commitment to upskill and to upgrade and to uplift the people of this county. And we know how to collaborate, we know how to work together. And so I'm excited to see this room full of all of you this morning. I will start with the protocols. First of all, if anybody knows, so restrooms are right across from the room, and we have water and refreshments here on the side. So feel free at any time that you want to partake with some refreshments if you haven't already. We have some very special guests here this morning, and I want to take a moment to recognize them. And one of them, I can't see him right now, but I know he's around here somewhere. Ron Reynolds, State Representative Ron Reynolds, where did you go? He's outside taking a call. Right? Yeah, he's outside taking a call. And then Mayor Staff from Fulshire. Are there any other elected officials that I did not know you were here yet, or a representative from a elected official? No? Okay. Okay, now, so you want to make an entrance. State State Representative Ron Reynolds is an advocate for education. He's an advocate for everybody in this county, and passionate about how to create ways in which we can work together to make Fort Bend County, to continue to make Fort Bend County one of the most sought after counties where families are coming in and moving into, and that's part of the reason that this area continues to grow. So let me start by kind of giving you a story about how we ended up here, because I had several people who asked me, what exactly are we doing here today? Do we have a booth? Because there's several organizations that are here. So you were invited intentionally and strategically because we think you're a critical stakeholder about the conversations that we're going to have today. But back in May, Houston Community College and Dwyer Workforce Development formalized a memorandum of understanding to train and support up to 500 new healthcare professionals in a year, specifically certified nurse aides. 500 new certified nurse aides. Why this is so important? And through this agreement, what ACC and Dwyer agreed to do was to launch the ACC Dwyer Register Apprenticeship Program. And many of you are going to be asking the same thing I asked at the time. Dr. Robinson brought this partnership to my attention, and I said, who's Dwyer Workforce? I've been in workforce for a long time and in this area, and I had not heard of Dwyer Workforce. So you probably are asking the same question. So Dwyer Workforce is a Maryland-based nonprofit organization with a record of supporting hundreds of students as they successfully enter the entry-level health professional credentials and launch their careers in healthcare, particularly certified nurse aides, because that's an entry point for nursing and for many other health professions. On this program and this agreement that we have with Dwyer Workforce, they're going to support 500 apprentices annually with tuition funding and hiring these individuals to work as certified nurse aides while they're training. So one of the things that as a college president and as a vice chancellor of workforce that I always, for all my years, have always noticed and been concerned about is I talk to students that come to the college and those who want to come but tell me they can't because they feel that they have to make a choice between going to college or paying for rent, paying for food. They say, I want to go, Dr. Murillo, but I gotta work. I can't go to school and not work. So the beauty of apprenticeships is the individuals are earning while they're learning, and they have a commitment of an employer to support them in that career trajectory. And it's an entry point, but it's critical for the state of Texas that we start looking at different ways in which we can create that talent pipeline in health careers. It's crucial for our state and for our region. Given the shortage of nurses in our region, many of you have heard that, right? Has anybody recently, a loved one, or you been in a healthcare facility to receive services? Because I know many of you here provide services. So if you provide services, you know that you're having a hard time hiring and finding that talent pipeline. If you are on the receiving services, you're probably experiencing long hours to wait to be seen or to receive services, or long time to make an appointment or to get into somebody's office, and it's because there's a shortage of healthcare professionals. In Texas right now, the shortage is about 30,000 nurses, and the number is expected to double by 2032. Double by 2032. And in the Gulf Coast region, is projected to have the greatest shortages in the state, with over 10,600 full-time positions, which is over almost 43% of the demand for nurses. That's right here in our region. So it's crucial. This partnership is crucial. Now, the other benefit of the partnership is we all know and we hear that unemployment is at a record low across the country. But I also know that there are sectors of our economy where unemployment is still high. And those are sectors that are vulnerable and underserved communities, that are those voices that I have heard over my career in education that tell me, I want to become a nurse. I want to go into health professions. I just have to work. I can't afford to go to college right now. And that is in our underserved communities. I believe strongly that in Fort Bend County we can create a model where all together, regardless of what part of the community that you're in, that we can come together to create a way that we can provide information and awareness of these career opportunities for underserved and vulnerable communities that can become part of that talent pipeline, that they no longer have to choose between going to college and paying for their bills, because Dwyer will be paying them wages as an apprentice. As they continue to progress in their career, they'll continue to earn higher wages, and they'll be hiring them with full benefits. Now that is crucial today for anybody who's a single parent who have children, really for anybody who has to access the healthcare system, to be able to have also benefits that can support a family. So I had a conversation when we had this agreement. Reverend Sincere and I were working on something else that we're working on. And I said, by the way, did you hear that ACC is going to be recruiting 500 new folks to go in through Certified Nurse Aid? And I explained to him the agreement, and he go, we got to tell everybody about that. And I said, you're right. How can we do that? And so I said, we can talk about it in your church, but how about all the churches? How about all the community organizations? So this man, Reverend Sincere, I want to thank you, because it was really bringing all of you here together is Reverend Sincere. And so we've been working together with him to bring all of you here. And again, that's an example of how in this community, when we talk to each other and we reach out to each other, we can make things happen. And I'm action-oriented. My entire team is very action-oriented. So there are going to be some actionable items that we're going to ask from you today. So I want to set that stage, that you understand that one thing we want is we need your help on how to communicate through your organizations to people who are looking to get into careers. How can ACC go to your community, go to your church, go to your organization? Do you have social media? Do you have any digital information that we can feed in the information about how to access this nurse aid apprenticeships that are available right now? And you're going to hear the panel speak about that. And the second ask is, we can't stop there. So Dwyer has developed, which I also learned, this awesome healthcare villages in underserved communities in Baltimore. And we were having dinner, and also she said, well, can we talk about this in Fort Bend and explore that? So I mentioned it to Reverend Sincere, and he says, oh, we got to talk about that with the community too, right? So we said, hey, we're going to bring everybody together. We're going to talk about the apprenticeships, and you're all going to help us get the word out, right? Every one of you now becomes a voice. There's CNA apprenticeships at ACC. You get hired, you earn what you learn, and you got benefits, and this is where you go. We'll tell you all that information shortly. But the other conversation we're going to talk about today is hearing how in Baltimore they created healthcare villages for underserved communities by bringing everybody together, all the different organizations. And that helps uplift our communities. So our role as a community college here today is to be a convener and bring that information to all of you. But what will happen from that depends on what this community decides. And you probably look around the room and you think about people, other stakeholders who may not be here right now. And we want you to tell us who they are so we can invite them to the future conversations. So you were here first when it started, and I'm looking forward to celebrating a lot of new things for Fort Bend County with all of your support. With that, I'm going to pass it back to Dr. Robinson. Thank you.
All right, well, let's get the party started, right? So we have an amazing panel for you today, and I know Dr. Burlow's introduced a few of them, but I'm going to give you a little bit more information. And over the next 30 minutes, we're really going to explain what these healthcare villages are and how this could potentially impact Fort Bend County. So the first person I'd like to introduce is Barb Clapp. She's the CEO of Workforce Development, Dwyer Workforce Development, an innovative nonprofit whose purpose is to provide these certified nurse aid opportunities as well as geriatric nursing. As you all know, we have lots of nursing facilities around here and population continually growing older. She provides, through their organization, wraparound services, case management of students, job placements, and as Dr. Burlow mentioned, this amazing opportunity, and I know she'll touch on it, but where else can you become a CNA and go all the way up through a master's program paid for by your company? That's amazing. So we're creating RNs here. And with that, the goal for this program that was created is called the Dwyer Scholar Program. And the goal is that they all get a scholarship to not only attend school, wraparound services. In this case, we're currently providing everything from bus passes to childcare. And these individuals have the opportunity to go to nursing school. She currently leads this nonprofit program operations, strategic partnerships, and this lady travels everywhere, let me tell you. I never know where she's going to be via text message. And before that, she was the CEO of Clap Communications, a full-service international marketing company, headquartered in Baltimore since 2001, and she sold the agency in 2018. She is a C-level advisor for the Emerging Technology Centers and sought-after speaker of leadership. Recently, Top 100 Women, an induction into the Circle of Leadership and Circle of Excellence. So let's give a round of applause. We also have on our panel Lydia Chavez Garcia. She is the Director of Collaborative Communities for Fort Bend ISD. She leads family engagement programs for Title I campuses, mentoring programs, community outreach, and her background is actually in higher education, most recently with San Jacinto College as the Director of Health and Safety Education, where she had extensive experience in workforce development, community engagement, as well as state and federal grant opportunities in the health professions, and very well understands the Department of Labor and the requirements for that. So we're a pleasure to have you on our panel this morning. Let's give a welcome for Ms. Lydia Chavez. And then the man who needs no introduction, Pastor David Lee Sincere, Jr. of Fort Bend Transformation Church and Advocacy Now Institute. He is a dedicated community leader, spiritual guide. He gives me spiritual knowledge all the time. An advocate for the economically disadvantaged. In 2017, he founded Advocacy Now Institute, an organization committed to addressing systemic issues and impact of disadvantaged communities. ANI's mission is to advocate, educate, mentor, and empower individuals and families and communities. In 2020, Pastor Sincere and First Lady Candace Sincere established the Fort Bend Transformation Church. The church's mission is to transform individuals, families, communities, spiritually, economically, and socially. Pastor Sincere's commitment to the community and advocacy is evident in his work. Every time you talk to him on the phone. He has initiated and overseen numerous programs addressing child and youth mentoring, housing, food insecurity, job insecurity, achievement gaps, criminal justice reform, and early childhood trauma. Let's give a round of applause for Pastor Sincere. And I forgot to mention, he is a licensed Baptist minister and member of several professional associations. All right, next on our list, we have Carrie Ray. Carrie Ray is a performance and innovation specialist for Fort Bend County Health and Human Services. She has over 15 years of experience working with individuals in groups and communities. She is passionate about creating systems to improve conditions for organizations and communities and the people who work and live within them. Carrie has worked for many different systems, including addiction, mental health, child welfare, homelessness, and most recently, public health. As the Performance and Innovation Specialist for Fort Bend County Health and Human Services, Carrie has led the department in their Community Health Assessment Improvement Plan, which she's going to talk a little bit about today, and the Strategic Plan. She has experience in development, implementation, evaluation, continuous quality improvement within programs. She not only brings a wealth of experience in community collaboration and team building, as well as research and training skills. Carrie has a master's degree in anthropology, social work, as a licensed social worker in the state of Texas. She's a native of Canada and has made Texas her home for the past 8 years. Thank you very much. Next on our panel, we have Crystal Broussard. She is a senior planner for the Houston-Galveston Area Council and Workforce Solutions. She serves as a senior planner and staff member for the Gulf Coast Workforce Board. She serves the 13-county region, remaining employer-driven, people-focused, with an approach that elevates the economic and human potential of the region to attract and retain not only the best employers, but dignity of the job, and she remains an indispensable asset to the global economy. So let's give a round of applause for Crystal. Is there anyone else I forgot to introduce?
No.
Oh, Dr. Omid.
So Dr. Omid is a very good friend. She is the Behavioral Health Director and Specialist in Fort Bend County. And we all know that health care and mental health is extremely important. I don't have all her credentials today, but she is one of the most dedicated servants in Fort Bend County that I know. And so let's give her a round of applause today. She had a previous meeting and she didn't know she was going to make it today, but we're so thankful to have her. And so she's our behavioral health specialist on the panel today.
Thank you so much. So as you can say, we probably have 200 years of knowledge on this panel, right? We've got a lot of knowledge, so they're going to help us today. So I'm going to start with Barb Clapp. Barb, can you tell us a little bit about your role and how Dwyer Workforce kind of came into the situation that we're in today? You want to pass one down?
Good morning. Can you hear me? No.
Here,
Good morning, everybody. How are you? Good morning. Lovely to see everyone in this room. We thank you for coming today. It's very exciting for us to know that we have all these great minds in this room, and we're going to get together and try to figure out how do we make Fort Bend County better, right? And how do we get more jobs in your community, specifically in the healthcare staffing world? You know who I am. I run Dwyer Workforce Development, and our mission is to help people who lack opportunity to improve the healthcare staffing crisis and therefore improve the lives of seniors. We started in 2001, and in Baltimore we've trained 200, in our first year, we trained 287 CNAs with a 84% stick rate. That is way above the industry norm, and we credit the fact that we have person-centered case management and comprehensive wraparound services. The person-centered case management is our secret sauce, though. You can train people over and over and over again, but they're not going to stick if everything that has touched them through the day that we're training them doesn't go away. It's not going to work. And if you lack opportunity, you hear no over and over and over again. So it's just as easy to say, I give up, than to say, I'm going to stick with this and go forward. So our person-centered case management, we touch base with the people on intake, our case managers, and they stay with our Dwyer Scholars from start to finish. We say we have Dwyer Scholars for a lifetime, and we are totally committed to taking people from just surviving to thriving. CNAs start at very low pay, but if they continue in the career ladder that we provide to them, they can become six-figure heads of families. First-gen grads, right? So we love all that, and it's going really well. We're doing it in Maryland, here in Texas, and in Florida. But it was kind of bugging me, like, what else can we do to improve retention and to change people's lives? And that's where I had the idea of a healthcare village. And it's a purpose-driven healthcare village. What we want to do is provide housing and childcare as a workforce intervention, because we see with our Dwyer Scholars, some of them live in cars to start. You guys know the circumstances that our Dwyer Scholars start in are unfathomable, really. So what can we do for housing insecurity? And I thought, let's provide subsidized multi-income housing and do it with one and two bedroom units. Many of our Dwyer Scholars are single heads of household, but we also have young people coming into the program, people aging out of foster care. We work with other not-for-profits to try and build our Dwyer Scholar workforce. So they are really encountering a lot of issues when they start. So we have this housing piece, and we're looking at buildings with units of about 40 to 60 one and two bedroom spaces. In that building, we will have childcare. We are really tired of our Dwyer Scholars having to get on a bus with a bunch of strollers in the rain, schlepping two stops past their stop to drop their kids off at daycare. They get back on the bus, they arrive at work late because circumstances are out of their control. They get a phone call half hour in, and one of their kids is sick. And they have to get back on that bus, and they have to go back to that child care facility, if they can find one, right? If they can afford one. So we can't have this. So we want to put child care centers in that building. We're also going to put a resource center in the village. And that resource center is a place, we have a 3,000 square foot footprint. And that is where our Dwyer scholars can train. A lot of the training, if it's not associated with the community college, is virtual. And our Dwyer scholars' home environments do not support virtual training. It's too hard. So we're creating cohorts in our resource centers. We'll have about 15 computers where they can come in and create their own cohort, get support. We're going to hire from the neighborhoods to man the housing village, including the resource center. We will also provide partner services with other not-for-profits in the area. So we'll have not-for-profits in there spreading their messages and helping to provide additional services to our Dwyer scholars. We'll use it for recruiting. We'll use it for supporting the people in the neighborhood. We will do outreach from our resource centers. You name it, it's going to be there. We'll do tax planning support, open enrollment support, everything we can to keep our Dwyer scholars on track. We also want to make sure it's near transportation. We hope that there's food access in the area. It's not a food desert. We look at the health detriments and how can we address those. So it's pretty much a purpose-driven village of housing. And can you imagine having that opportunity as a young Dwyer scholar to start there, and as their salaries increase, their rent will increase. They can stay as long as they want, but that's the idea of the village per se. I do want you to know what's happening now. So we're doing it in Maryland, in Baltimore City, very challenged environment. We're doing one in West Baltimore. We've already started, we signed MOUs in West and East Baltimore. West Baltimore, you may be familiar with Freddie Gray, and that was where he grew up, that's where he died. And it is such an underserved neighborhood. We are partnering with another faith leader, and Pastor Hudson, is a Methodist minister who is getting support from the Methodist Church, as well as I have support from state government. I'm getting grants from Department of Housing and Community Development. I'm creating a capital stack that I can piece together with impact investing. My not-for-profit is affiliated with the bank, so I'll have some money from there. So I've pieced together the money to do this, and we'd have to do it in Fort Bend County. We can do it. I know we can. So we're doing that in West Baltimore as well as East Baltimore. We're working with Bishop Hickman. And he's further along. Pastor Sincere and I have been talking about it, and he's going to come up to Baltimore and meet Bishop Hickman and also Pastor Hudson. They're further along, and they can get us there. They have a template that we can do here in Fort Bend, so it's not arduous. We also had something very interesting happen, and that's why I'm so excited about this HCC partnership, because they have been incredibly supportive of what we're doing. They're not just doing apprenticeships with us, they're living our mission with us, and I cannot thank them enough for that. And this affiliation, I know, will help us move faster in this community. But we have a partnership that we're going to start with the University of Maryland, Baltimore. And University of Maryland, you may know shock trauma. It was the first shock trauma place and one of the best in the country. They are very innovative. They are in a very urban center. It's not a good area. And they only have 700 people that live on campus. I've known them for a long time. They want 7,000 people living on campus. So we're going to do a partnership with University of Maryland, Baltimore, where we put the resource center, the housing, and the child care right there on their campus. They're going to put housing for their students, School of Nursing and School of Social Work, and then my Dwyer scholars will be in there. So my Dwyer scholar will get on an elevator with a School of Nursing or a School of Social Work. That modeling for them is going to be phenomenal, because when you lack opportunity, you've never had anybody model a behavior or help you with your decision making, and that's what a lot of our case managers do all day long. But those are models, they're examples, so that you understand how it works. But I feel like we can get together here and make this happen. And you may say, why Texas? So we own 64 skilled nursing facilities here in Texas. I have 7,000 employees here in Texas, and we're throughout the state of Texas. We've changed them from for-profit to not-for-profit facilities. So we'll be doing outreach in the communities in which they are. I acquired them on September 16th. And that's also why we can do apprenticeships and those kinds of things, because there's a team from Regency here. John Ballard led that team. And John has led the apprenticeship initiative in our facilities, because it's difficult to put together a CNA apprenticeship. But he's made it work for us, as has his directors, administrators of their facilities, and I thank them for that. But that's what it is. That's what we're hoping we can do today, and I thank you for your time.
With that being said, Pastor Sincere, get you that microphone. How do you see the interfaith community playing a role within this healthcare village moment?
Okay, I want to start off by really making this personal, because it is very personal for me. When I was around 7 years old, my mother and I fell into some hard times. My common-law stepfather passed away, and we almost lost everything. So the work that I do is very personal. And it was a church that came and helped us out. They helped us with our rent. They invited me to the church. We were not members there. Even on my birthday, they brought me a birthday cake and some gifts. And there was an attorney that was a member of the church that took my mother's common law case with Social Security pro bono. And about 6 or 7 years later, they won the case. My mother received a check in the mail for over $20,000 in Baton Rouge. And we purchased our first house in Missouri City. And so this work is very personal for me. I told God that I would never forget where I came from. And so that is the why. So I know that the interfaith community can make an impact. We don't have to proselytize to do this work. How many faith individuals of faith do we have in here today? Yes. And I know that many of you do this work because you care. Now, how can the faith community make an impact? We volunteer in our communities, right? Many of our faith individuals in the faith community, they have multiple disciplines: healthcare, social work, social sciences, business, and all of these different disciplines that you went to school and educated yourself on. And the thing that in the healthcare village, the thing that I imagine, I can see it in my mind, I can see it, is that the power of having a healthcare village is not about what we do individually. It's about what we do collectively. It's about us coming together, connecting the dots on behalf of these young people. And so you ask the question, well, how can the faith community get involved? This is a representation of every agency, every individual here that works in the church, that volunteers, that works for an agency, whether healthcare or whatever you do, can make an impact concerning this healthcare village. So here's my call. I'm not going to be long. I'm not going to preach. But here's my call to action. We're stronger together. We can make a more prodigious impact together. And so my call of action is for everyone in some way, form, or fashion to get involved so that we can help the most vulnerable. When I think about those young people, I think about my situation. And just like that beautiful church, Gethsemane United Methodist Church, came to our rescue and helped us out, the faith community can make the same type of impact in the lives of our young people right here in Fort Bend County. Thank you.
Thank you. Thank you. Dr. Almeida, can you tell us a little bit about your role what you're seeing right now on the healthcare front?
Is it on? Yeah. Wow. So just a little bit about myself. I learned that there are no coincidences. My PhD is from University of Maryland, Baltimore County. Many years ago, 1985, probably before some of you were born. But for almost 40 years, I've worked with in the public sector, trying to develop systems to really keep children and families together, to keep people out of jails, institutions, and so this wraparound work is something that I've been doing for years. And I have to say, when I first came to Texas, Fort Bend County, almost 35 years ago, and I talked about wraparound, people just really didn't understand it. So I am so encouraged to actually see these principles that we know are evidence-based and necessary, like person-centered case management, wraparound services, actually being applied to such an innovative area. People need jobs. So it's interesting. I'll talk a couple points, and I won't go on. Also, I could talk forever about this. But in Fort Bend County, one of our very successful initiatives is we have a crisis intervention team out of the sheriff's office. So, been working for years with them on developing this. So basically, it's so that we train law enforcement to be able to identify mental health needs, respond appropriately, avoid incarceration, avoid injury to the individual and to the officer. It's been extremely successful, right? So one of the things I have them track is like Medicaid. I also have them track what kind of social determinant needs are there. Employment is the number one. So when they go out, just think about it. When law enforcement is going out on a crisis mental health call, what is the most common identified need? Employment. Because of course, that means you can't, if you don't have a job, you don't have money, you don't have stable housing. So this is just so critical. And it's just really so exciting to see how creative and how really, it just makes sense. Like, for example, I've seen this. I've done some work in Harris County, and I remember, so people to get to the appointment would have to take 3 buses. It's like, really? And I had to, actually, I see Mary Covington over here in the audience, but we had a judge that actually went undercover, and so she actually got on the bus to try to make it to whatever the probation requirement was, and it was like, wow, what an experience. So thinking about, what does it take walking in people's shoes? And I've been working in this field forever, and so sometimes I get accused that I just want to take care of everybody, I'm enabling, I'm a tree hugger. That's all fine. It's fine. But, it's like, if you haven't lived through those experiences, you really don't know what it takes. So, when a judge, and I work with judges a lot, and when they say, well, you need to get a job, or you get a job, and then you need to go get your drug testing, and then you need to be over here, and then you need to go see your children. So I also work with CPS, and I see those orders that are from CPS, and honestly, I have a PhD and a lot of experience, and I don't know if I could follow one of those. So I think this is so important how this is being done, because we want people to have meaningful work. But honestly, if you're going to be paid minimum wage, and that's a whole other issue about what that is and how inadequate that is, but then you're expected to drop off your child at daycare at 5 o'clock in the morning so you can take 3 buses to get to work to make minimum wage, which might put you at risk of losing other benefits. Is that really sustainable? So Again, I could talk about mental health, I could talk about a variety of things, but I just think this is exciting, and if we really want to deal with the mental health crisis that we're having with this country, if we really want to build a more resilient community, we need to look at these initiatives about co-locating services, providing people with meaningful jobs, and the supports to keep those jobs. Thank you.
That leads us straight into Carrie Ray, because Carrie Ray has been doing a lot of work on the Fort Bend County Health Improvement Plan. Can you tell us a little bit about your role and what you're seeing with regards to the health assessment?
Yeah, thank you. So again, I work for Fort Bend County Health and Human Services, and our vision is healthy neighbors living, working, learning and playing in healthy communities. And I think that's what we're talking about today. So that is our public health vision. We provide a lot of services in the community as the Public Health Authority. So we have everything from your local animal shelter to clinical health services, which is immunizations for kiddos and for people who are on Medicaid, and those who are uninsured. We provide our epidemiology services, chronic disease. We even have EMS is under our jurisdiction. We also provide social services, so those basic needs. And we provide indigent health services, so people who have the lowest income in the county that are not covered by Medicaid or Medicare, do not have health insurance through their employer, we provide them with some sort of medical benefits. And so recently, we, as the health department, completed our first community health assessment in the last 15 years. And this is something that was done with the community. We engaged over 845 people in the community. We asked them to provide feedback on their health, the health of their neighbors, the health of the community. We also met with 25 key stakeholders. So these are leaders, healthcare professionals, leaders of nonprofits, people of the faith community. I see a lot of friendly faces in here who met with me to talk about health. And we compiled all this data to tell us the health of Fort Bend County. And overall, Fort Bend County is very healthy, very wealthy, but there are definite pockets that need support, right? And there, we came up with 5 priority areas for health. Number 1, which Dr. Almeida just spoke about, is mental health. I don't think that is a surprise to anybody in this community. Mental health is an issue primarily because of access. We have only 1 mental health provider to every 1,210 residents in Fort Bend. Wow. Texas as a whole has a better ratio than we do, okay? So when we talk about workforce development, it's like, how do we get that pipeline and provide more mental health professionals into our community, okay? The second health issue is housing. We've learned from COVID, housing is healthcare, right? How can you socially distance, isolate if you do not have a roof over your head, right? How can you meet other basic needs if you are not in a home, right? How can you pay for your copay if you're depending on how you keep your rent, your competing priorities, right? So affordable housing is our second priority, followed by obesity, heart disease, which is the second leading or is the first leading cause of death in our county, and then access to prenatal care. So after we provided these results to the community, we engaged the community again. We met with over 170 stakeholders that represented 70 organizations in the community, and we asked people, how do we address these priorities? And we came up with a community health improvement plan. And this is not the public health, this is not the Fort Bend County improvement plan. This is the community health improvement plan. So you can find this community improvement plan at www.fbctx.gov/ FBCTX.gov/CHA. I'll say that again. FBCTX.gov/CHA. There you can read the community health plan, and in there are strategies about how to address those 5 major priorities. And what I think we're going to be talking about today, and what I already brought up, is some arching themes that came out of our plan, are leveraging partnerships and collaboration, promoting awareness and education, and increasing access to services, care, and programs, right? So we can talk about all those priorities, but if we don't have access to those services, in a healthcare village and people can access them, we can have as many services as possible, but if they're not accessible in languages, at off-peak times when people can access it outside of their workday, it's not available.
Thank you. Lydia. As healthcare villages strive to provide person-centered care, what role do you see the school district playing in building these?
So at the school district, we already have a lot of relationships with so many of you. I've seen some that we work with already to provide that community connection. We also have the Whole Child Health Program, which provides curriculum to parents, to teachers, so that they can provide that healthy information. We have on-site clinics that provide the vaccination with the schools for students. But I think, for me, when I came to the district, I came from that community college background and workforce, and I worked with high needs parents. At the college, I worked with the Title I campuses, which are high needs, low income families. So I reached out to Christina, which thank you for inviting me, Christina, to bring HCC to provide parents with more than just the healthcare classes, but also thinking about how do you get them out of that cycle. At the college, I had a parent that was working 3 jobs, trying to get through a program. And so I would like to see our parents be able to get out of that cycle in taking the training that's available to them, and maybe taking that heavy lift off on how to balance all of that without the appropriate, without the appropriate supports from you. Hopefully with the housing that comes along with it, they'll be able to be more successful, because it's a big heavy lift on them to balance when life happens. The other thing I would like to see, and I would be working with our internal teams and Christina, is to develop youth apprenticeships so that you can get them ready so that they can try, preach,
We want those.
to build those youth apprenticeships. Apprenticeships are a little bit scary for those that have not been involved in that, but having those discussions, and we've started those, to have youth apprenticeships to get the students to get exposure. You have people saying they want to be nurses, they hear it makes a lot of money, and then when they actually find out what they have to do, they're like, no. But having multiple areas of youth apprenticeships where they can try it and then be exposed, earning money while they're doing it, and then creating a clear pathway for them to the level that they want to go to. So I think that partnership is going to be helpful.
Crystal, as we talk about workforce training and education, can you tell us a little bit about the role HGAC is playing within that process?
Thank you. So HGAC, or Houston Galveston Area Council, has been here at least 42 years. And we're not going anywhere. So under the workforce branch, the branch that I work for with Juliet Stepesh, our esteemed director for 1 year. I'm sorry she can't be here today, but she wanted me to represent if I can. What we want to do is continue the work of meeting the community and helping the community build upon resources from folks like you in the audience. We want to put all of the resources together. We want you guys to use us to tell us what we need for our 13-county region. Currently, I live in Harris County, and we have lots of needs, but I know that I previously lived close to Fort Bend County, so they're still in my heart. What I will say is that what I heard about we call it pre-apprenticeship when we think about youth. And we have a dynamic senior manager who's handling youth. Her name is Christy Rangel at our organization. So she could, of course, help with that. We are working with everyone, the city, the counties, and I love that I got to meet Barb and Maria last time we met, you guys. And what they're doing is just amazing because never before have we had CNAs up here and can bring them up higher. They're important. I was telling somebody, we're all gonna age and we're all gonna need them. So I think that is such a noble profession and I'm for it. But we are governed by Texas Workforce Commission, the Department of Labor, and so we do have guidelines that we need to follow, but we are happy to explore any ideas that you guys come up with here today. And I will take back to Juliet all that I've heard, and we are here for you guys. So thank you for having me.
Thank you. As we talk about opportunities, I would be remiss if I didn't mention, I oversee the Gulf Coast Region Apprenticeship Hub. And with this hub, we actually not only provide apprenticeships for healthcare, but we've got over 20 occupations. So when you think about people looking for careers, they can go to hccs.edu/apprenticeship hub, and they can apply for an apprenticeship in all of these programs. They are earn while you learn programs, but they're getting full benefits. They're getting their tuition covered in almost every case, and they're getting a 1-year contract with the opportunity to renew. So I just want to mention that. I don't know how many of you all have been involved in apprenticeships. I know we talk a lot about plumbers, welders, pipe fitters, but now we've got HR, accounting, IT, you name it, there's an apprenticeship for it. And we've really started breaking even into the culinary world at hospitals as they need food services, right? So think about every kind of role that you might have, maybe even an assistant. That can be an apprenticeship opportunity. So I want to thank our panel today. We're about to get you all engaged now. We have an activity. We're going to be, each of you guys have been assigned a table. Our team's going to be walking around putting a table ticket on top, or table tent on your table. And there's 5 key areas that we're going to cover today at your table, and you're going to be assigned one, okay? And our idea is for you to help us create this conversation on this healthcare village. So we're going to be passing out your texts, and then you're going to get a 1-pager. And I just want to give a quick overview before we wrap this piece up of what you're going to see. So there's 5 areas. Carrie touched on a few of them. The first one is infrastructure. How are we going to actually build an infrastructure to make this happen? We know an infrastructure is critical, the housing that Barb mentioned, in order to have a healthcare village. Second is collaboration and community engagement. A healthcare village has to foster collaboration. So what is that going to look like? Workforce education and training. What are the critical roles that we need to support this healthcare village? Carrie also mentioned community health workers, right? That's a huge need we hear about all the time. But there are so many other roles that we might need to be successful. Person-centered care and case management. Emphasizing this patient focus, or not patient person. I have to retrain my brain. I did a patient paper, and so now I have to retrain my brain to say person-centered care. But anyways, with that being said, what's that going to look like? How might it be different in a healthcare village than it is today when you go to an office? And then lastly, financial stability. Where are we going to get the money to make this happen, right? And be able to sustain this long-term for the Fort Bend community. So you guys should all be getting a 1-pager. You need to select a scribe and a leader. We're going to give you 20 minutes to work on this, and then we're going to come back to our panel. And Pastor Sincere is going to help facilitate this conversation. You will have a helper at your table shortly.
Some ownership with the healthcare village. And so we're going to start off with the infrastructure group. Come on, let's give them a big hand, the infrastructure group. All right, experts, do they have a mic? Who's your spokesperson?
They don't need a mic.
Hello, my name is Genesis Elizondo. I'm with the Texas Department of Family and Protective Services. And
all right, stand up so we can see you.
Okay, so our group, we talked about how it would be a really good idea to have like a one-stop shop to help accommodate for everyone's needs. So like they could be mental health, physical health, lab, X-ray, and even pharmacy could be in one place, so that way the individuals who come don't have to go to different places. They can just get everything done in one building. So like an inclusive one-stop shop. We even talked about possible accommodations for transportation, like for example, Uber Health, Curb to Curb, or Fort Bend Transit, to have some type of contract with them, so that way it can be easier for the patients to have access. We did also talk about childcare. We were just kind of familiar with NCI here in the local area. And then also we talked about having like initial paperwork or like whether it be digital or physical referral to make sure that we have all the needs, the clients, or I shouldn't say client, patient-specific needs, so that way we can make sure they have accommodations when they do come, whether that be some kind of physical accommodation for a handicap or just other special accommodations in general for their specific needs. I don't know if we decided on some type of location. Where was our location? We thought we wanted it. We wanted it to be central, but we also wanted to consider the factors of where are there not as many medical centers, right? And also where the need is. Like we wanted it to be where the vulnerable, probably where there's more poverty, so that way they could have more access to that. And then those were the issues and topics we discussed.
All right, let's give them a big hand clap. Y'all have a plethora of items on your list, you get an A. Okay, and so we also have our financial stability group. Where's our financial stability group? All right, Shannon. I know y'all are on point. Shannon is at the table.
Hi, everybody. Shannon Stavnoa. I am the Executive Director of Park Street Ranch. We are an emergency shelter for kids, so this is right up our alley of trying to find workforce development and ways to support our kids who are aging out of the foster care system or are experiencing homelessness. So these are my babies that we're talking about. So we really focused in on sustainability and suitability and focused in on diversifying that funding mix. So I think that some key pieces for this project would be to leverage government drawdown funding. We talked about CDBG, NOFO for permanent supportive housing. There are child care subsidies that are available in the state of Texas, so drawing down those and really leveraging those dollars to support the work.
There you go. There you go.
What were they? Okay. Sorry. Okay. The other piece too is there's some state funds that we could use to draw down that have been allocated for prevention early.
All right, we got to pray for the mic.
For prevention, early intervention dollars, so we have those opportunities that you can pull down some PEI funding. The Texas State Legislature, thanks to Representative Reynolds, has done amazing work to fund and add excessive funds for prevention, early intervention. So I think you could draw down some of those pieces. The other part of that, when you're talking about that funding pie, is really looking at the opportunity you have for income, and the pieces of income that we talked about were a mixed-use facility. So places where people have access to a grocer, a restaurant, a childcare, those types of things that are right there in the community to support the whole community, not just the groups in the village. So, and then I think the last piece that we really wanted to talk about is There is some concern with going in the philanthropic route to grants and that because you're new and we don't know you in Fort Bend County. And I don't know if you know, but Fort Bend County, we're a little bit particular. And so there is that challenge, but I think if you look at this as a strategic initiative that you can implement there are some foundations that would be able to support that work. And then of course, private funding. We talked a lot about the private investment from insurance companies because they have initiatives, because they see that a healthy patient is a more profitable patient for them. And so if we can maximize that investment, then that would help us in sustainability.
And I'll just mention, we have an insurance apprenticeship as well with several insurance agencies, so maybe we can leverage that as well.
All right, and Barb, you know me. Shannon, I know you, and you have all the money, so we can figure it out.
So I got you.
All right, so we also have the Person-Centered Care Group. Person-Centered Care Group. It's my friends with Regency.
Oh, perfect.
Table behind. All right, come on up. Come on down. Help us out. Come on, y'all. Let's give her a big hand clap. It takes a lot of courage to be the spokesperson.
Tag team.
Tag team. Oh, they tag team.
All right, you want to go first?
I'm Ned Velasco. I'm with Regency, and I run Stevens Nursing and Rehab in Hallettsville, so we're a little bit out. Ours was the person-centered care, so nursing homes are already doing that in person-centered care. So for us, you know, it's most important to educate your staff and to train them. That is key. And then, you know, we need to interview the patients to discover what their needs are and how we can do things better for them. That usually is a very long process because they don't always come out and tell you that. So that is a, you know, you need to just continuously ask and find out what they want. So that feedback is very important in prioritizing what the individual needs are. So that to us is very important, is to find out what they want.
All right, tag team.
Okay, and so what's the role of technology? So we definitely believe that there should be 24/7 telehealth available. And using the existing health information exchange to ensure that patient electronic health records and information from different physicians, if they were to see them, would be able to be utilized. And we know that the Greater Houston Health Connect already has that in place, so we would want the village to be a part of that. And we need a partnership. We need to partner with existing health organizations. One of the opportunities that we actually talked about is having actual in-person healthcare 24/7, which would be primary care, because most of this work is shift work, and what happens is when people work at night, they tend not to be able to go to the doctor, or even when they have a day shift and they get off at 7, that there is no doctor, and that's not the same as going to telehealth. And so having that primary care available 24/7 would be critical. Now, we also recognize that that's an economic burden, and so one of the things that we thought that would increase the relationship between the healthcare community and the village would be that any healthcare worker or somebody who worked in the healthcare industry would be able to utilize those 24/7 services, which would then provide a revenue stream to support those services. And we thought that the way we would get the word out is advertising and promotion, but also partnering with schools, so that so it would be a bridge from high school. People could bridge quickly into where we are.
All right, let's give them a hand clap. And I'm going to give a personal shout out to my friends with the Regency. Raise your hands. My grandmother, when I was her primary caretaker, they took care of my grandmother at a facility. So come on, let's give them a big hand. And so we also have our fourth group, which is workforce education and training. rally group. That's the rally group. Come on, who's your spokesperson? Oh, there go my friend. Come on. Fort Bend Family Promise. Oh, they tag team. Tag team. Oh, man. One day I want to be like y'all.
Good afternoon, everyone. My name is Etta Harris-Benson. I'm with Fort Bend Family Promise.
My name is Charmaine Natal. I'm also with Fort Bend Family Promise as the Youth and Family Planning Program Assistant, so I work closely with the youth.
And as an agency as a whole, we service youth that are in families experiencing temporary or episodic homelessness within our county, because everybody knows there's no homelessness problem in Fort Bend County. Our area was workforce education and training, and so I'll just go down the letters here. So we decided as a group that some of the training that is needed for this area would definitely be mental health education, also language proficiency. Our county does have a equal mix of Hispanic, African American, and also Caucasian, and we also have a high Asian population as well. And then technology would definitely need to be included, as we are we need digital literacy because the median age is about 32 years old, but with the diverse mix, a lot of different cultures are either afraid of computers or just even email. So digital literacy would definitely need to be a priority. And then also we learned that there would be housing in the community as well. And so with that housing component, we need to make sure that we're not separated, we're keeping families together and not separating based on age, gender, or sex. Yeah, or gender. And then just basic life skill training is a high priority in our county as well, such as finance and all of those other barriers that would be presented to this group of individuals. And then how we can foster a culture of continuous learning and professional growth amongst the healthcare village staff. We said that making it available and providing incentives to those that are going through the program to either come back as advisory council or having them pay it forward by offering mentorships for those that graduate from the program to give back. And then just continuously engaging those graduates of the program would be very helpful.
And then we do have a last point. It's what methods can be employed to attract and retain skilled healthcare professionals within the village. So we actually came up with a lot of points for this one. It's pretty much allowing each, at least the staff to be able to collaborate and synchronize within each other, to be able to at least provide mentorships to the upcoming staff, being able to show them that they are able to provide values within the village, being able to provide values because people can witness what those graduates were able to go through, how they got to where they are. Also, being able to provide an alumni or LinkedIn community, just being able to network within each other. Also provide expectations that, even though they graduated and got through the program, they still should be able to continue with help or helping the village. Just having them make that commitment to, even though they graduated, they can do bigger and better things, but being able to still service where they came from. And also, being able to provide different certification levels, so that way they can still help service the village, but also at the same time gain that knowledge and certification level or training that they would like. So, We did also come up with incentives as far as what they could gain, being able to access higher paying jobs, being able to move forward in their education, not just what they graduated from. And also resources that should be accessible, for a lifetime among the village. Keep that connection.
Yeah, so basically, in summary, we just want to make sure that this community is not a handout, but we want to be able to empower leaders and empower them to be able to give back to the community.
All right, Fort Bend Family Promise, Workforce Education and Training. And our last group, Collaboration and Community Engagement. Where is that group? Oh man, I know Wise is at that table, so I know y'all came up with some good stuff. Come on up. Oh, we have a young person. Come on, let's give them a big hand. Internship and State Representative Ron Reynolds' office.
Other than your department?
Hi, my name is Shreya Sharma, and I'm an intern for Rep. Reynolds. I'm a high school student. I'm a rising senior. So the first order of business is encouraging collaboration. So we proposed quarterly meetings so that everybody stays up to date. And we have regular meetings that people can look forward to and check-ins. Second is organization, right? Organization is key, and we propose that this should be done through some sort of timeline, so we're not just sitting there and talking about the things that we're going to do without doing them. So, having some sort of agenda is really key here. Next, some sort of committee structure I think would be helpful. So that we can relay all the information covered in the meetings back, so that everybody stays updated. Dividing things into different committees so that everything stays pretty organized. Next, in regards to communication in the village, having liaison representatives for each agency, like I said earlier, or having one or more people per sector. I think that might be helpful for facilitating communication, so that if anybody has a particular issue, you can go to that person. Then for advertisement and outreach to the youth, having billboards and having presentations at schools and starting at the source, encouraging young people to pursue professions in healthcare is really important, I think, and establishing a major network of businesses and organizations within Fort Bend. Now, next is networking opportunities. So we believe that engaging with healthcare providers and organizations in Fort Bend County, so that they have incentive to help their own community and provide quality care, is probably the best way to go, instead of outsourcing professionals from other counties and things like that. Helping your own community, it's a direct incentive to stay involved.
All right. Thank you. Come on, y'all. Let's give her a big hand clap. Didn't she do an awesome job? Man. She did such an awesome job. I'm concerned about my job. And so those are our 5 groups, and we really appreciate your feedback. I want to give a special shout out to my good friend, Dr. Barilla. Thank you so much. She is a change agent for Fort Bend County, and the whole team that has helped put this together, including our panel. Thank you so much for taking out your time. Barb flew down here from Baltimore, and now you just gave me a reason to visit my aunt that lives in Baltimore. And Maria. So thank you so much. I really appreciate everybody responding to the call, and we got a lot of good information. I'm going to turn it back over to.
Okay.
Are we going to meet again?
Yes. Yes. So our follow-up, actually, first of all, we're taking all of this information that you all provided us today. We're going to put together a report. so we know what the result of today was. Second of all, yes, plan on a quarterly meeting coming up. So you're going to have a recap. We hope you all will come so we can talk about not only what the findings were, but how are we going to put this in action, right? And then you mentioned timeline. We've already talked about timeline, but obviously the community needs to be part of that discussion, right? So those are just a few things. I did want to make a point to note, if you're here today, we're building a consortium for this, right? Because if we're going to do funding, what do you have to have? You have to have a consortium, right? So obviously we have our amazing friends here, but if you're interested in serving on a committee or being involved, let us know. And like I said, we do want to see you back here so we can continue the conversation, and we'll be sending out an email with that date, as well as email to get feedback from you all on today's event. So once again, thank you to the panel. Appreciate all of you. Thank you to all of you for being so engaging today and participating. And we hope you have a fantastic rest of your week.